Let's talk about the over-the-counter pain and fever medications available for kiddos. Let's start with the acetaminophen, which is generic for Tylenol. That's this side. It comes in a suspension, rectal suppositories, and the chewables. The chewables are really good for kiddos who are old enough to chew the tablets and who don't really like the suspension. I don't care for them as much because you can't titrate the dose as well. The rectal suppositories are really good for babies, and you just take it out of the package, gotta take it out, and it's a little waxy bullet that you put in rectally. I like them because babies don't take suspensions, a sticky suspension, as well as the older kiddos, and sometimes choke on it. So the rectal suppository is a nice option. Now the acetaminophen suspension only comes in one. It's children's and infants all in one. There is no separate product. I prefer the dye-free suspensions when I get them, and you can dose this from day one, just depending on the baby's weight. You just figure out the dose. Now let's move on to ibuprofen. Those are generic for Motrin and Advil, and these do come in two separate ones. There's a children's ibuprofen and an infant's ibuprofen. They made infants so that they put more medicine in a smaller amount of liquid so the baby can actually take that one. You can use either product as long as you dose it appropriately. Ibuprofen doesn't have a suppository option, so they had to give you a concentrated option so you can get them to take their medicine. Ibuprofen is approved for 6 months and older. So now the question is dosing. It comes with these dosing cups, but I don't really like them because look, they say 2.5, 5, 7.5 milliliters. But what if you call the doctor and the doctor says, oh, they need 3 milliliters? Well, how are you supposed to figure that out? So I recommend oral dosing syringes. I get these from the local pharmacy. You just ask and say, hey, I need to dose my over-the-counter medicine with the recommended dose from my doctor. Can I have one? And they usually give you one. And if the doctor says 3 milliliters, you just pull it down to 3 milliliters and give it. The other question is, well, what dose do I give? I have the go-ahead to give these medicines. What can I do? I recommend the Pain and Fever Dosing Guide for Infants and Children. My sister and I are both moms and pharmacists, and we created this, and we love it. All you do is pull up the dosing chart for whichever product you're using. If you're using acetaminophen, you pull up the acetaminophen red table, and you find their exact weight. You go down the table, and it gives you the exact dosing range. So you can choose the low dose or the high dose. We do this for the suspension, we do this for the chewables, and the rectal suppositories for acetaminophen, and we also do this for the suspension and chewables of ibuprofen. Now make sure you're matching the ibuprofen product. So if you're using children's ibuprofen, you use the children's ibuprofen table, and if you're using infants, you're using infants. Like I said, this is available on Amazon for $14.99, and it is super helpful. Have the dosing syringe ready to go so you can give your child their exact dose they need.